I hope you enjoy this review and find it helpful in your studies. You can get full ad-free access to the MedEd 101 Nursing Pharmacology Review course at meded101.com/nurse. MedEd 101's Nursing Pharmacology Review course is built to make meds finally click. You'll get nearly 20 hours of ad-free, on-demand video lessons, downloadable slides you can study from, over 40 cheat sheets and study guides, and practice questions to assess what you know. Whether you're preparing for exams or building real-world confidence, this course is designed by pharmacology experts for nurses. Stop memorizing, start understanding pharmacology at meded101.com/nurse. In this section, I'm going to cover the most commonly used dosage forms and some of the tips and tricks associated with these. All right, so objectives, know different dosage forms of medications, know the different routes of administration, distinguish between the benefits and pitfalls of different dosage forms and routes of administration. So for this section, I'm going to focus mostly on dosage forms, but obviously those kind of blend and blur a little bit together too. So, all right, so the list of dosage forms there, we're going to go through them one by one. All right, so tablet, capsule, so differentiating between these. Tablet is a hard compressed medication. You can have what are called coated tablets. So this can sometimes help with masking taste and those type of things. Medicines can be pretty bitter, particularly if they start to dissolve on the tongue a little bit before completely swallowed. So that's a potential advantage of those coated tablets. We can have chewable formulations. Obviously, those we can crush and split. Any type of kind of standard tablet, in most cases, I'm not going to say all cases because it's not true, but in most cases, we can typically, crush and, mix in certain types of food. So, but that's something you always want to double check because there's no real rhyme or reason or perfectly good tricks or tips on that. Every medication's a little bit different as far as what we can do with it. But most tablets, you're definitely more likely to be able to crush it and break it in half and things like that if necessary. So disadvantages of tablets, they can have that unpleasant taste. They don't have that kind of capsule coating. And then obviously for administering any type of oral medication, you have to have a conscious patient. So if we're, need a medication for acute relief of something, in an emergency type situation, and we've got an unconscious patient, obviously that's a big issue. All right, capsule is a medication. Often times it's going to be just a powder contained within a gelatin container. And that gelatin, it can vary in hardness and softness a little bit. Advantage, you're not going to really taste that ever. It's just going to be, kind of the outside gelatin, plastic type of texture almost. You can open and sprinkle most of these. When we're talking about doing this, though, sometimes that can be challenging. The example being if it's powder in there, which it is often for many capsules, when you pull that apart, all of a sudden that powder can kind of go everywhere, and it leads to the question of did they get the entire dose? Now we've got other medications that have like little beads and balls in there, which don't go up and blow around in air. So those are going to be a little bit easier. Some types of sprinkles types dosage forms. Disadvantages with capsules, depending upon the size, may be difficult to swallow, and certainly just like tablets, we have to have a conscious patient that's able to swallow things, of course. Ointments, creams, and lotions. So these are typically going to be used topically, on the skin, those types of things. Ointment is considered a semi-solid, greasy type of preparation. Picrolimus, lidocaine, those are two commonly used ointments. Cream is a semi-solid mixture of drug with oil and water type of consistency mixed together. Tretinoin cream, hydrocortisone cream, those are good examples there. So ointments typically going to have more of that opaque type of look to it. Creams are typically much more white in color. And then lotion is an aqueous preparation for external use. So lotions are typically going to be much more liquid than a cream and an ointment. Solutions and suspensions. So solution is a liquid preparation, dissolved and evenly dispersed. Advantage of this is you can use it for systemic purposes and localized effects as well. It's easy to administer this versus oral tablets and capsules, so this is probably most classically used in pediatric patients and patients that have difficulty swallowing. We want some sort of liquid, right? So that's what we're going to typically use there. Whenever you incorporate water into something, whether that be a solution or a suspension, it increases the risk for that compound breaking down and getting contaminated with bacterial contaminants. Okay, so that's an important thing. Usually they're going to have much shorter shelf lives than a tablet, for example. Now, with a solution, I mentioned that preparation, the medication is dissolved within it. You can't visually see anything. It just, simply looks like a liquid, for example. Now, a suspension is a liquid preparation in which the drug is basically in tiny clumps or small clumps. And when we shake that medication, we disperse those tiny little clumps all throughout the liquid. And so this helps to make sure that we get an even dose when we take that medication. Because if you think about it, if you've got a suspension and everything's down on the bottom and you have a patient not shake it and just pour it out, that medication is going to be all sitting on the bottom. So essentially you'll get too little of a dose probably right away, and then towards the end you'll get an super therapeutic dose or too high of a dose because that drug has become more concentrated. Many of your antibiotics used for pediatrics, your liquid antibiotics, are suspension. So amoxicillin being the most commonly used suspension there that I've seen in practice. So the big important education point with the use of a suspension compared to a solution, suspensions, you have to remember to shake before use. Okay, so that's a great patient education point. Again, we want to make sure patients are getting the dose that we think is appropriate for them, and if they don't shake it, they might not get that adequate dose. Suppository. So this is a small, solid, medicated mass, usually cone-shaped, to be more easily inserted into the rectum or the vagina. Advantages of this is localized onset or localized use, so treating a localized type condition. Can certainly be administered to unconscious or intubated patients without issues there. Disadvantages: for many patients, it's certainly not a comfortable thing to insert something into the vagina or insert something into the rectum. So that is, kind of the big challenge with those. Hydrocortisone suppository, Dulcolax suppository, Dulcolax being used typically for relief of constipation. Transdermal patch. This is a medicated adhesive patch that is placed on the skin to deliver drug through the skin and into the bloodstream. Now, I will say some patches are used more locally. So a good example there would be like a lidocaine patch. So that one you actually put right on the site of action or the place where the patient is feeling the pain. Fentanyl patch is absorbed systemically. So fentanyl needs to be absorbed through the skin into the bloodstream, and it needs to get to the central nervous system to have its effect. And so that's the way that medication works. Advantage, you can get a really, really smooth delivery of this medication. It's slowly going through the skin, and it can give you a nice, steady, around-the-clock delivery of the medication. Now, the disadvantage, concentration may vary, and that absorption rate may vary a little bit if you've got patients that are, exercising. Maybe they're using a sauna or a hot bath. This can increase the rate of absorption and maybe alter those concentrations and potentially lead to a higher risk of adverse effects in that setting. Some people don't like patches. Some people feel like they fall off too easily, and those type of things also can be irritating to the skin if patients have sensitive skin, or maybe it's a drier time of year and that's causing issues or something, or maybe it's excessively humid and they're always sweating and it's difficult to adhere that patch. So there can be some challenges there. We just want to make sure that we're that those patches remain on that patient. We're continuing to deliver that medication. I will give one word of caution with fentanyl patches. They're extremely potent, so there's been case reports of young children, pets, getting these out of the trash, or maybe it fell off the individual patient. There has been case reports of pets and young children dying because they put this in their mouth and they overdosed from an opioid like fentanyl. So pay attention to that. Super important patient education, patient safety piece there with fentanyl patches. Injection, so this is an infusion method of putting liquid into the body. Basically, IV would be straight into the blood vessels. Using a needle and syringe, of course. Big advantage, rapid onset. Big disadvantage, we're using the needle, so painful. Also, you can't really take it back if there's a concern about wrong dose or wrong med, or we did something wrong. You can't really get it back versus oral. We can maybe do activated charcoal or some other things to kind of prevent absorption from happening further. Whereas IV injection type medications, that's not going to be an option in that setting. So some of the injections I see commonly used, so B12 or cyanocobalamin injections, and then of course insulin pens are super common. Nasal spray, so this is a solution containing medication for administration into the nose. This is with the aid typically of patient force, so the patient coordinates the squirt or the pumping action of the nasal spray device and inhales. Their inhalation corresponds with that. Advantage, typically localized effect, can absorb that medication through the nasal mucosa for systemic effect as well. Two common examples: fluticasone nasal spray, really commonly used for allergies, and then naloxone or Narcan, used for opioid rescue there. Now, naloxone, we're looking more so for the benefit of systemic absorption. Fluticasone and saline spray, we're looking for localized effects to help allergic rhinitis, runny nose, those type of things. Some people don't like nasal sprays. They're uncomfortable sticking something up your nose, that type of thing. You can also have some contamination issues as well. Some people may be a little bit more prone to damage of that mucosa, irritation, and potentially nosebleeds as well, which is something I've seen. Now we've got an aerosol or an HFA. So typically inhalers, That's what we're going to talk about here. So drugs with a mixture of aerosolized propellants held under pressure within this dispensing device. The advantage of that inhalation, we can get that direct localized effect for the lungs, which is commonly used in asthma and COPD. Disadvantage, patients really have to be able to coordinate that breath with the use of their inhaler. Classic example here is the albuterol inhaler. All right, here's a few others that I'm going to mention. They're definitely less common in my opinion, but I wanted to throw them out here. So enema is a liquid preparation for rectal use. Fleet enema or Fleet's enema is a commonly used medication there to help alleviate impaction and constipation. Lozenge gum, so this is, I think, pretty self-explanatory. It's got medication within it. One of the more common medications there is nicotine replacement therapy, so like Nicorette, lozenges, and gums. Powder, so we can use medication in powder form for oral or topical use. Typically, it's going to be topical use. Sometimes when we use powders, we mix it with liquid and take it orally as well. Shampoo, I think that's pretty self-explanatory, and usually that's going to be used for hair purposes. Ketoconazole shampoo, classic example there. Tincture, so this is a medication actually in solution of alcohol. So there's CBD tincture, for example. Important thing to note here is that a tincture has alcohol in it, so that can be problematic for some patients, and obviously sometimes pediatric patients, of course, but also maybe those with alcohol use disorder and things like that as well. There's medicated films for buccal or sublingual use, where basically you pop that film into the cheek for buccal use, for example. Suboxone, used for opioid use disorder, is a good example there. Chewable tablets for oral use that can be chewed without losing its medical properties or inducing any type of unwanted side effect, like a terrible taste, for example. So lamotrigine's medication with chewable tablets, and a lot of times are pain relievers like Motrin, ibuprofen, acetaminophen. They have chewable dosage forms. Hey, nurses and nursing students, want to reinforce pharmacology without boring old flashcards? Check out the Nursing Pharmacology crossword puzzle book from MedEd 101. It's an Amazon bestseller. It turns drug classes, mechanisms, side effects, and high-yield facts into fun, brain-boosting puzzles that help you remember what matters most. With over 2,000 questions and clues, it's perfect for study breaks, group review, or solo practice. This book makes learning pharmacology engaging. Grab your copy and start mastering meds in a way that's actually fun. Find it now at meded101.com/nurse. That's meded101.com/nurse.